Hi, I'm Steve Podmore. Well, some of you who know me realize I've been absent for quite some time. And for those who don't know me, I'll give you a little bit of background. So, about 2.5 years ago, I had to put the project that I've been working on for many years on hold. My brother was very poorly, and ultimately he passed away in June of 22. And as a result, my mother, who lived with my brother, or the other way round, Michael lived with my mum, needed a lot more attention, a lot more time. Either she came to London, or I came to spend time with her in on the Cheshire-Staffordshire border, and obviously, as a result, time that I could devote to my work was reduced quite a lot. But then back in May of last year, 2023, it was a period where Mum was having a bit of time on her own at her home. She was getting increasingly frail in the early 80s, but she still wanted her private time to grieve for my brother, but it was getting increasingly difficult. But I got the phone call no one wants to get. She'd had a stroke, a very serious stroke, and I rushed up north and managed to get to her bed in time in the Royal Stoke Hospital in the acute stroke ward that's Ward 127, which is amazingly a leading stroke ward for the country. Incredible people, and Mum was able to survive, although she had a number of chest infections. She was very poorly, but about a month later, she was able to be discharged to go to the Haywood Community Hospital, which was for rehabilitation. She needed that. She couldn't. She could only barely walk. Her speech was affected. Cognition was affected with aphasia, and her right hand was essentially, right arm was useless from that point on. Anyway, she had 3 months in the Haywood, where my brother Michael and I were both born, and then in September she was able to return to her home here in Church Lawton in the Cheshire-Staffordshire border. So when she'd had the stroke, I essentially moved straight up from London to visit her every single day. And then when she was able to come home to look after her, she needed a great deal of help and support. We had assistance from carers initially, but in February I decided to take on my mum's care entirely. And to say it was difficult is an understatement. To say it was the greatest privilege of my life is, again, a significant understatement. Despite her debilitating challenges from the stroke, she had quality of life. I was able to take her to visit her friends and some family members, and to take her for lunch or for coffee. She loved having a mocha, but she needed constant help, and I didn't, if I'm honest, know how long I could go on. But then, very sadly, she had a second stroke in July, and this was perhaps more serious. Certainly, initially it didn't appear so. She had this second stroke, and she passed a month later in the early August, in the 3rd of August, which to me is and was devastating. But in that time, I got to learn a lot about stroke. I was also asked to help facilitate meetings for the local chapter of a national charity called Different Strokes, all about peer support, or organising peer support for young or working age stroke survivors. And in the time that Mum was in hospital, when she had a second stroke, she was admitted to the Royal Stoke again, to Ward 127, and I'm incredibly grateful for the care and the attention that she received. But there was no way she was coming back from that, and she, although she was robbed of so many faculties, she still had the determination to refuse food and drink and any medical attention. And yet she still survived about 2.5 weeks after that. She was medicated or sedated from the palliative care team. But in that time, I was able to get to know many of the medical staff, both at the Hayward, in the Royal Stoke, the broader stroke community, and realize what a massive burden stroke is on society. So while I was there spending time and watching my mother die, I started to think about what I was going to do to pick up the pieces of my own life. And I spent a lot of time thinking about how just incredible the NHS is, how much my family has benefited over the years. And but also as an observer, a very keen observer, I should say, and someone who talks to a lot of people, I realized there's a lot of things wrong with the institution, or the many institutions that make up the NHS, as well as there are things that are incredible. And those things really need attention. They need system thinking. And what it also dawned on me, speaking to many of the staff, just the terrible problems that they encounter on a daily basis that were stupid problems. I mean, really, really stupid problems that delay and frustrate and lower morale and get in the way of patient-centric care. Talking to people is actually quite a novel concept, because those people who are at the coalface, let's say, and my grandfather actually died at the coalface, very close to here, in a place called Chatterley Whitfield, on my father's side. But those people at the coalface in the NHS are the ones who really know what's going on. And I've had many conversations. I was also fortunate enough to get an invite to a thrombectomy conference that was organized by some of the most learned professionals there are. Thrombectomies are where essentially a clot is removed mechanically by some very, very talented people. And yet, only a quarter of the country is in a catchment area where they can have a 24/7 thrombectomy provided. And ultimately, what does that cost in terms of lives? Well, I talked to one professional, and we tried to do the maths, and it's 3,000 to 4,000 people die unnecessarily because of the lack of service provision. Now, some countries don't have that same lack. Germany and Australia, the numbers, I believe, are an awful lot better. So the question is, how can, and if you don't have a thrombectomy, you're either going to die or there's a very good chance you're going to be permanently disabled. So when you look at the cost of that permanent disablement, particularly if people are young, that's a massive cost on society and families, a financial cost, but of course it's an emotional cost as well. So what I believe, and this is a subject that is understood, the shortfall, but not to the extent that is required. And I don't believe the solutions or indeed the appropriate levels of pressure are put in the right areas to address these issues. I don't go into the complexity of turning 25% country coverage to 100%. If that was indeed possible, then it's probably not, because of rural area, hyper rural areas, and what have you. But still, the concept really is so important, and yet, do we really know that we're perhaps losing 3,000 or 4,000 people a year unnecessarily, and the burden of their disabilities financially is more than the cost of actually providing those facilities? I mean, this is the kind of thing that we need to talk about and really get out into the open. So basically, I came up with the concept of taking one of the components that I devised for Transform, that's the media platform, and taking that and essentially putting that into putting that platform concept to use in the NHS. And rather than going straight back and working on the financial project, even though I know that we need to have healthy economies for a healthy NHS, that's a broader issue. Even though I know that, and I believe I can play a part, I think first I've got to help fix the NHS. Well, really, my part is small. It's about the conversations, and it's about the platform, and it's about really then crowdsourcing the knowledge and understanding and the sort of channeling the influence to get important stuff done, to transform and to save lives, so to speak. So I'll just give you a little bit of let's fix the NHS. So I think there's 4 steps that are important. Preventative, that's really the public health aspects of getting a healthier nation. Healthier nation equals a much lower burden. So we really think we need to channel knowledge and understanding and the nudge type activity to help reduce smoking, increase fitness. And I don't smoke, but I need to definitely lose weight and to ensure I'm not a future burden on the NHS. We've got to increase capacity, and that's by incentivizing the kind of joined up thinking and practice that we need and bringing that out into the open. We've got to embrace the future. That's by investing in medical and organizational innovation. And we've got to upskill talent on so many levels. We've got to champion leadership and indeed communication on every level. Unfortunately, we don't just have to upskill talent. We've got to attract the right kind of talent. We've got to think ahead, and we've got to do that in a way that's fair to everybody. You know, using agency staff as an example that are paid very highly but don't have certainty or much in the way of job security. Those middle providers may play a role, but they take an awful lot of efficiency out of the system. So nothing is off the table. Everything has got to be discussed, and it's got to be discussed in a way that's not just hiding behind closed doors and private supposed experts who are talking through these things. Everybody who's got a role to play should be included. So our solution to this is a crowdsourced think and do tank. The whole concept is built around a YouTube channel and a content creation platform. So this very first video obviously is an amateur attempt, but hopefully it'll get better. And of course, when we bring experts and the real talent in, of course, things will get better. We want to create, and in fact, I've already written a rudimentary website, but it really has to be about NHS reform and innovation. The plan is ultimately to do events and incorporate education into them, and also into the media platform to really have a lot of volunteers and supporters, as well as ultimately professional staff delivering social media and communications, because ultimately it's about really creating change. So what's the content about? Well, the issues, whether it's about stroke and thrombectomies and the burden of society, and how employers really don't take their responsibilities seriously most of the time for getting people back into the workplace and don't necessarily understand the issues. This issue needs discussing. It needs properly discussing, and it needs publicizing. We want to be evaluating proposals, hearing these great ideas for change out, and making sure they're properly thought through, discussed, evaluated, and if sound, promoted. Those solutions have got to be promoted. There'll be one-on-one interviews and there'll be panel discussions. So what is the purpose of this platform? Well, it's about helping save and helping transform lives. Comes down very, very simply. If we can fix the NHS is probably a bold statement, but if we can have many, many, many little fixes, it adds up to something very significant. And if we can create change and support change that can both save and transform lives, then it's building quality of life for everybody in this country. And potentially using this knowledge, it can be shared around the world. And equally, we should be learning from those elsewhere as well. What's the business model for this? Well, sponsorship, potentially from valid parties, consulting, content creation, and investment. And when I say investment, it's possible that we could raise a fund and invest in some of the activity, or at least invest alongside other investors in the kind of innovations that could make the change that we need. So that's the concept, and I hope you like it. Please take a look at the website. There's only a couple of articles on there at the moment. There's probably more than a few mistakes, but the goal basically is to get this kicked off, to raise some investment so we can get a team as soon as possible, and so people can have a stake in this future. So we'll be going forward with that very soon. But I want to thank you for watching. Why am I doing this? Well, I want to create a legacy for my brother and for my mother. I want to, and for my father. I want to thank the people who've been so supportive and who've supported my family in the NHS. And I want to help create the change that I know could help an awful lot more people. I feel incredibly fortunate to have been born in this country, to have been able to avail ourselves of these services. And I really just think it's a miracle. I think it's incredible. And I don't believe that we would be best served if it disintegrated. So Wes Streeting, the Health and Care Minister, has launched also a platform, change.nhs, I think, .org or something similar. And it's interesting. It's got some great ideas from individuals about how to create change. But those ideas need scrutiny, they need evaluation, they need discussion. And the problem I see is that this is just a lot of data, but not too much qualification, if you like. So with Let's Fix the NHS, we want to discuss those proposals and suggestions and many others. We'd like to partner with relevant external organizations. There is something called the King's Fund, which is an incredible organization that does research, advocacy, very similar aims, to what we want to do, but quite a different approach, and also quite a big endowment that they are doing their very best to make use of. So maybe we can partner, but at the very least, we will be referring quite often to their research and to their work, because that needs discussing too. So again, thank you for watching. If you want to get in touch, if you want to get involved in any way, feel free to send me an email through the website, and we can talk soon. And hopefully we can talk face to face on this platform. Many thanks.